Well, let's take you to Rustenburg now. This is ahead of the country's commemoration event, and that's where we find our reporter, Refiloe Seboko. Refiloe, good morning to you, and let's talk about TB. It is a curable disease, but in certain instances, people do die from it, and those are the people that have not sought help in the way of, going to hospitals to seek some help. How is the government aiming to promote that people get out there and get the necessary help?
Well, without wasting any time, Xoli, let's just find out that from the MEC of Health in the Northwest Province, Madoda Sambatha, to talk about how the department, MEC, in the province dealing with issues of TB. We know now that a number of people are dying from this disease.
Yes, of course. It's a disease discovered in 1882 by Dr. Robert Koch. Still today, it's a killer disease internationally. And also South Africa is not spared death through TB. It is very simple that it is expected that every South African or all persons in the world should test for TB earlier, so that earlier detection means any earlier initiation to treatment. And when you are initiated to treatment, TB treatment is very clear that you must stay to your treatment, behave, take it as expected for 6 months, and then assessed post that. And the reason why many people die is because first, they take time to come to facilities and be checked. Secondly, when checked and detected and initiated in treatment, majority of them do not take the treatment as expected, and therefore it becomes uncurable in that instance, yes, yet TB still remains curable.
And how much of a concern is it for you as the department in the Northwest about TB, especially in mining areas like Rustenburg?
In our province, TB is dominantly in the mining sector, and in actual fact, this is why mining on its own has huge impact in health delivery in a province, because TB and HIV and AIDS are both higher in the mining districts. And in mining, the impact is that those that are initiated do not keep up the program, and then they get lost to follow up. Because once a mine worker today and no longer working tomorrow, and a decision of a person on where to reside based on the fact that he's no longer working leads to a process of break-up in keeping that person in the program, of break-up in follow-up. But yesterday, we're launching a program with Sibanye Still Waters, which seeks to integrate the mining data with the Department of Health data. So anyone who gets in that program that Sibanye has designed, which is functional, is going to be a shared program between the mining sector and the Department of Health. This is going to help us so that someone who's no longer working but he's in the system and program of TB reflects on the side of health, yet in the previous situation, it was difficult to take someone or detect someone who was in a mine program and later lost employment and therefore should be in a government program. With that system, it's going to be simultaneous mine, health, and this is going to help reduce the number of people who get off TB program.
Thank you so much for your time. MEC Madoda Sambatha of the Department of Health in the Northwest Province. We just saw Minister Joe Pasa as well. Remember that he will be part of this commemoration. He walked in. We're just still waiting for Deputy President Paul Mashatile to arrive.
Refiloe Seboko, thank you very much. Live for us in Rustenburg today. And that's where we're going to commemorate World TB Day.